Today we will be measuring knee flexion. Knee flexion occurs in the sagittal plane. First, make sure the subject is supine with the knee in extension and make sure to position the hip in neutral. Before doing anything, make sure to stabilize the femur to prevent rotation, abduction, and adduction of the hip. Hold the subject's ankle in one hand and the posterior thigh with the other hand. First, begin with a passive range of motion to check for any abnormalities within the joint itself. Next, have the subject perform the movement themselves and make sure their movement pattern is normal. Next, place a towel roll under the ankle to allow the knee to extend as much as possible. When aligning the goniometer, center the fulcrum over the lateral epicondyle of the femur. Align the proximal arm with the lateral midline of the femur using the greater trochanter for reference. Align the distal arm with the lateral midline of the fibula using the lateral malleolus and fibular head for reference. Again, in order to test the motion, hold the subject's ankle in one hand and the posterior thigh with the other hand. Start off by moving the subject's thigh to approximately 90 degrees of hip flexion. Then move into knee flexion. Stabilize the thigh to prevent further motion and guide the lower leg into knee flexion. The end of the range knee flexion occurs when resistance is felt and attempts to overcome the resistance caused by additional hip flexion. Measure this angle and record appropriately, making sure to document resting position prior to.